since I've got memory of it, I've always been quite, concerned about people's health and animals' health. And I remember, like going to the doctors with my mom and just seeing like all these sick people queuing and just being like, Mom, why are they feeling sick? Like, what can we do to help them? And there's an anecdote that my mom always tells, because she used to make me these like broth that would cure everything, like just to make me feel better when I was sick. And I would just like, when we were at the doctor's, I was like, maybe we should make broth for everyone, Mom. So I always had this sort of inclination to like wanting people to be healthy and to be happy. But I didn't have a quite clear idea of how to make that happen. So as I moved along my career, I sort of have been shaping these in different ways as I've learned about the science behind and as I've learned, about myself and my own interests. So I guess like for me at that point when I had to pick a degree, the most obvious idea was like, I need to understand better human physiology and pathology. So I enrolled in a biomedical science degree in Barcelona. And that was like 4 years of intense training where I've learned, like the little details of how the human body works, what are the main pathologies and molecular pathways behind. And that was just amazing to me. It was fascinating to understand the machinery behind our bodies and how it works and how it cannot work. But then I realized that I was missing something. I started doing an internship in a lab and I felt that there was something missing for me, which was more the human aspect of it, the bigger picture. We are a species that is very much social and we live in communities. And for me, that was missing in the training that I had. So then I moved into doing more public health because I thought that would give me this additional perspective of humans as communities and how can we change things that eventually affect our health, how things in the environment, both environmental, social determinants, can actually have a much bigger impact than things that I had learned on my degree. Like molecular changes obviously are huge, but they're not that common, whereas social determinants and environmental factors are out there. We're constantly exposed and they can shape your life. I then enrolled in the master's on public health in Girona and Spain as well. And since then, I've been in this path of more community research and public health research and epidemiology. I worked 2 years at Imperial College as a research assistant, doing population studies and ecological studies. That was a great opportunity for me to, hands-on learn how these things work and how do we go actually about to make a difference. And I was really lucky to be in a really active group that was really involved in governmental decisions. So we were commissioned, projects that eventually could inform policy, which for me was an eye-opener. It was the first time that I was like, okay, my research can actually have an impact. And it was such a clear way to see it. And at that point, I realized, that this is what I want to do. I want to do research. I want to put my skills at the service of people. I finished my master's and then I wasn't sure whether I wanted to commit to a PhD or not. I wasn't sure what my path was. So I decided to apply for jobs and I got these 2 years of research assistant as an epidemiologist. I did that. And that's when I realized, I do really like this. So I want to continue training to actually become more of an expert on this and progress on my career. And so after those 2 years, I had an idea for a project that I was really passionate about on climate change. I proposed it to my then line manager. She thought it was a good idea. And so I started looking for funding. And then I was awarded a scholarship to run that study for 3.5 years. And that's what currently I'm doing at the moment. And I'm on my 3rd year. So in my early years, when I was working as a research assistant, and also before in my master's, I think Manolis Cojevinas, who is at IS Global in Barcelona, was really a model to follow. He's a world-leading expert, and I got the opportunity to collaborate on one paper with his team. And it was just a really nice experience, not only in terms of like the quality of the research, but also he's a really nice team to work on. And it really for me, it broke a little bit the stereotypical idea that we have of academia being competitive and, a toxic environment. It was a really nice welcome to academia for me, which, encouraged me to stay and not leave. And then I would say my mentors were Anna Hansel was my line manager, and then Daniela Fecht. They both have been two female role models for me. They're really good researchers, leading their fields. I was really lucky as a research assistant at Imperial. I was allowed or invited to go to the IC and present the work I was doing at that moment. So I think that was my first exposure. So it was in Ottawa in Canada. I had a lot of fun. It was also an incredible conference because it was a joint conference with the Exposure Society. So it was huge. And just seeing so much research being conducted and like the quality of it. And it was just incredibly inspiring as an early career researcher. But I guess like my entry point was through the SNRN, which is the early researchers group. I had a colleague friend who was part of the committee, and then there is an annual turnaround. So when she left, she, I had heard her talk about it and how great it was and how, you could like meet all these people and help promote things within the society. And, so when she left, I applied for the position and I was accepted. And that was July 2020. So that's when I started officially being involved. A lot of the people I cite on my papers attend those conferences, or now I have meetings with them and I organize side events or webinars with them, and I've been citing them for ages. And I think the beautiful thing is you realize that at the end of the day, they're people. And I think that humanizing that figure for me helps a lot because it becomes something more attainable and desirable to be. It's like it becomes more of a role model because you see that they're people with a life and they have fun and they care, they're passionate as I am. Within my department, the group is not that big, so for me IC has opened the door to be able to collaborate and have discussions with other researchers who work on the same topic that I might not have in my own institution. For example, with Ana Vicedo, who is at Bern University leading a climate change team. We've been putting together these webinars for climate change methods and data, which have been part of a series of webinars in the IC European chapter. The IC has really helped me to build those skills. They offer trainings. I've been actually involved in real examples of how these happen. So writing a policy brief, which I never had written before, and I was able to be part of this team who was writing a policy brief of how do we interact with the media if we get a consultation to have an interview. All these kind of things that are not necessarily built in the traditional training for an epidemiologist, but we are seeing that it's incredibly needed. And then as an SNRN member, over the years, what they have advocated, and I think it's great, is that we can send representatives to the different committees that the IC have. So as you know, the IC have different committees that cover things like policy involvement, communications, and so on. So as SNRN, we had really advocated for having an early career researcher be part of those committees because we think it's really good for, training those like new generations to then prolong the change that in the impact that IC is doing. So thanks to that, I got the opportunity to be part of the policy committee as an SNRN member and also the European chapter because I'm based in Europe. And those two have been pivotal in my career, I think, and in my time at IC because I've been able to be involved on things that I would have never dreamed of. So just to mention one, the new guidelines for air pollution that were released by WHO, IC was really important on shaping those guidelines. Our committees and experts acted as advisory teams and groups for the WHO, and as a society, we prepare all these like media communications and letter specifying our positioning in favor of these guidelines and pushing countries to take a step forward. And I was really lucky to be involved on that endeavor. And I, together with other members of the SNRN, we coordinated the translation of this paper to more than 21 languages to try to make it accessible to all the countries, because we realized that that was a big burden and boundary and challenge for a lot of countries. It's been a great opportunity, and just being able to see it in these conversations with experts that you admire, that have had such an impact and still have such an impact in society, how they're shaping where things are going. It is incredibly inspiring always. I would like to see the IC take a much stronger stance in policy and civil engagement, because up until now we've been doing a bit of a reactive job. Things happen and then we react, but I think we should be more proactive. We should put the agenda. This is something that we're working on as a society. We're trying to engage more with the world. For example, climate change is obviously up on our agendas. So we are really trying to come up with a way where we can be more active and have more of an important role, be sitting on the negotiation tables. The clearest example is the COP. There is a health pavilion, but that's a side event. It's never part of the actual negotiation tables. So health, it's always constantly being put on the side when it comes to actually making the decisions. And we obviously believe that that is a mistake, because we could take these catastrophe and crisis and try to actually build a better society, a more sustainable and healthier society, instead of just trying to fix the problems. And health is a huge aspect of that. I think as more people and more research is being conducted and more, researchers join the society who have an interest on climate change, I want to see that being built into a more structured way.